Yeah, 100%.
I think it's good to frame it that way as well, because even people that know, if you go, oh, I'm going to go and do rehab today, like nobody gets excited about doing rehab. It's not exciting.
Solely up to that.
And then, that's that psychological aspect we talk about. All of a sudden, like, oh, I'm doing rehab and I'm doing rehab because I'm injured and I'm only doing this because I can't do what I want to do. Whereas, if we have someone, I don't know, you take a young guy who's got a knee injury, it's like, yes, we need to do these exercises that, maybe your physical therapist has given you, maybe we think you should do, but then equally, we're going to get really jacked in the upper body over the next 8 weeks. Yeah. All of a sudden, massive switch. Or if you take, I don't know, a mum with a shoulder injury, it's like, oh, you can't do, these full body things. That's okay. We're just going to really focus on smashing the glutes. Like straight away, bang. Like it just gives them an actual goal. And they're still, I guess, identifying as somebody who's training, as opposed to, oh, I've got to rehab this injury for 8 weeks, because 8 weeks can seem like a hell of a long time.
Yeah. Yeah. It's a game changer for sure. And I can't say I've ever really received any pushback on it.
No, I think most of them, if anything, like for myself, when you have this conversation and, not push them, but nudge them out of their comfort zone a little bit to say, hey, you're better off doing this. Most of the time they're going to feel better for it. And that's, whether or not it's a long-term injury or like you said, like, oh, I've tweaked my back a little bit. Like if someone says that to me, I'm like, hey, just come in. We'll start with the movement prep that we normally do. If it starts to feel worse, then that's fine. Then we won't continue. But hey, if you start to feel good, we'll still get some work done for the day. And
and you know they're gonna feel better.
Yeah, exactly.
We just say
we know.
We're saying traps.
And I think what's brilliant is the term itself, like trainable menu. I mean, I think the phrase kind of sells itself too. It's just
absolutely.
It's just a very nice, palatable and digestible term. It's not intimidating. Again, we're just saying, hey, we're gonna focus on what you can do. And we're gonna attack it, and it kind of sells itself, which is nice too.
Yeah, absolutely. With the whole trainable menu approach, has that changed, I guess, your movement screening assessment over time in terms of simplifying things?
It's definitely framed my assessment, and because I mean, if you would have walked through one of my assessments like 10 years ago. 10 years ago, I was definitely like trying to point out every little thing that was wrong with somebody. Like, oh, I gotta, look at this, look at that. We gotta fix this. And this is, over time, I've just kind of learned that, we don't live in a textbook. And this is not to bemoan or downplay what we learn in those textbooks. I think that's very important. But human beings don't live in a textbook. We don't live life in a textbook. So I think the trainable menu, if anything, with my assessment, there's certain things I'm always going to look at. The squat pattern, I'm going to look at active versus passive range of motion on active straight leg raise, or even active hip flexion, or even shoulder flexion. And certainly if someone comes in with a previous injury, or they're coming in symptomatic, of course I'm gonna peel back the onion on that. If someone comes in with low back pain, I want to find out, okay, what movements. Is it flexion based or extension based? Like what movements exacerbate it? Yes, I'm gonna try to find that out. But if anything, just trying to really understand that once you start a relationship with a client or even a potential client, and you're constantly using words like broken, dysfunctional, fixing, I don't think that's a nice way of starting a relationship.
No, I think that's a good point.
And I think and people get pretty intimidated when you tell them they're coming in to get assessed. It sounds judgy,
doesn't it?
Like, oh, this person's gonna rip me apart for 45, 60 minutes, and they're just gonna tell me I'm a walking ball of fail. And early in my career, yes, that's exactly what I did.
All guilty of those coaches pointing out what's wrong with you.
Absolutely. It's the natural growth of any coach and trainer. But I think the less of that verbiage that we use in an assessment, the better. And just really focus. This is not to downplay any injury history or symptoms that they're having. Of course, you're going to address that and have a discussion. But I still, even on day one, am trying to set the tone of like, okay, we are going to focus on what you can do. because we're going to find that, and that's going to be our building block. And I think that's just a nice way of starting any relationship with a potential or a client and athlete.
Yeah, fantastic. Well, I guess we'll move on to our next topic.